Okay, thank you very much, Gillian. So our next presenter is Caroline Hynes. Caroline is senior pharmacist from St. John of God's Hospital in Stillorgan. She's also an honorary clinical lecturer at the Royal College of Surgeons in Ireland. Caroline has worked in the mental health pharmacy for over 8 years and was the second Irish pharmacist to be accredited by the College of Mental Health Pharmacy in the UK. Caroline is going to talk to us about a patient-centred approach to both education and learning. Thanks.
Thanks, Loretta, for the introduction, and thanks for having me here this afternoon. I'm really looking forward to speaking to you about our partnership for learning with the School of Pharmacy at the Royal College of Surgeons in Ireland. St. John of God Hospital has a long tradition of as a teaching hospital for many disciplines, and in 2013 we took a new approach to our engagement with healthcare professionals education through a memorandum of understanding with the School of Pharmacy at the Royal College of Surgeons in Ireland. So we hoped really just to enhance the way mental health was taught to pharmacy students. We wanted to evolve from a kind of or a lecture-based and theoretical approach to a more person-focused approach. And we hoped we'd be able to support students really just to increase their knowledge and their confidence in delivering mental health care, regardless of their area of practice, whether they, become community pharmacists or work in hospitals or work in the pharmaceutical industry with Loretto. Our theoretical basis was founded on Fink's taxonomy of significant learning. And our shared hypothesis was that the learning environment of the psychiatric setting at St. John of God Hospital, combined with the content of the new mental health programme for pharmacy students, would build on their foundation knowledge to support the integration, caring, and the human dimensions of Fink's significant learning experience. So underpinning this approach are some core clinical concepts. Firstly, recovery, which is a deeply personal and unique process of changing one's attitudes, values, feelings, goals, and skills. And it's, I suppose, a way of living a satisfying, hopeful, and contributing life, even with the limitations of a mental illness. Patient activation, which refers to the knowledge, skills, and confidence a person has at managing their own health and their own health care. And finally, then medicines optimization, which is a person-centered approach to effective medicines use. So it's to ensure the best possible outcomes from the use of patients' medicines. So we believe that good care involves a partnership between the person and the healthcare professionals, where people matter more than their separate health conditions. So over the last number of years, we've had a successful collaboration with significant and measurable outcomes. A literature review was carried out to understand the training and educational needs of pharmacists to support the provision of mental health care in their area of work. And the evolution of the mental health programme in RCSI is actually the subject of a research project. RCSI then in turn has recognised the contribution and the educational input of the pharmacy department to its undergraduate programme by appointing honorary clinical lecturers who have brought considerable expertise to the mental health programme, and I suppose this also includes the social, the cultural, and also the political impact of mental illness in Ireland. A novel site visit programme with multidisciplinary input is delivered to students, and this has the aim of giving them a broad kind of idea of recovery-focused care. And as one of the students actually wrote in their feedback forms following the site visit, after the site visit, they realised that mental health care and recovery is not just all about the medicines. We also facilitate student summer placements for the pharmacy students. The hospital has benefited from the expertise and the research capacity within the School of Pharmacy by participating in the development of research protocols with the final year students, but also facilitation of formal higher level education at master's and doctoral level, of which I'm actually one of the lucky beneficiaries. We have award-winning researchers in our department, and the hospital and the RCSI collaborated to deliver the My Health public education lecture in 2015 entitled Mommy's Little Helper, The Irish Relationship with Anxiety Medication, which received significant media attention. Service user input to the curriculum has evolved to include co-facilitated teaching and service user and carer review of the Masters in Pharmacy programme. And also mental health first aid training has been offered to all students to support both their clinical communication as pharmacists, but also their personal well-being. Post-course evaluation has actually shown that mental health first aid has significantly improved the confidence of the participants to engage in mental health care. It's now embedded in the curriculum. This was an action that actually resulted from service user and carer input into curriculum design. Qualitative and quantitative research has shown that the students enjoy the programme and they've gained much more confidence in delivering mental health care. Our approach to collaboration and the techniques we have used are actually now influencing the educational approach for other programmes within the university. And so at a special event held in the hospital in May during Mental Health Awareness Month, we celebrated the success of the partnership to date. We included people from all disciplines and users of the services that had contributed to the educational initiatives. We were joined by the Dean of the Faculty of Medicine and Health Sciences, Professor Hannah McGee, and also the Head of the School of Pharmacy, Professor Paul Gallagher, among many other colleagues from the university. We agreed on our ongoing commitment to a person-centred model of care for optimal mental health, which is values-driven and with interdisciplinary teaching, and is facilitated through a recovery approach with a key role for the service users and carers whose contribution is often, I suppose, unrecognised. We're looking forward to the continued success of this collaboration in the future. Thank you.